Now coming to the arthroscopic animation. Now we'll be showing you something like what is exactly and how it is done. As I told you, the primary viewing portal is always the anterolateral. So if this is a left knee, you can appreciate that the left knee, the trocar is in, this is the sheath, and you have, as I told you, that nowadays the modern arthroscope has an inlet and outlet portal for the water inflow. You can attach the inflow over here and outflow from there. Therefore, the water can go in and out from this, the same source, without actually creating another portal for inlet and outlet flow of the water. This is the light source, and this is the main primary camera portal which is actually being utilized. Nowadays we have a graded index diffraction system in which is actually multiple lens. The lens can also be 30-degree scope, there is 70-degree scope as well as 90-degree scopes as well. Normally 30-degree scopes are used, but we can also go for 70 or 90-degree scopes as well. Now the difference between is actually in 30-degree scopes the lens is actually tilted 30 degrees, so you are actually not seeing in front. You're seeing what is exactly the 30 degrees to your viewing angle. In 70 degree, this is further tilted to 70 degree. In 90 degrees, it's almost tilted up to 90 degree. So when you were putting the portal in, what you're actually seeing with a 90 degree scope would be something which is just lying under the surface of the, at 90 degrees to that. So you have to train yourself in judging like this, and you have to make it sure that you understand all the associations with this as well, because nowadays the new endoscopes, arthroscopes which have come up is in which that you can actually change the position. Normally it's fixed at 30 degrees, but if you wanted, instead of putting a new lens, you can just rotate with the use of a button up to 70 degree, and the lens would actually curve to 70 degree and then to 90 degree as well. So you can actually rotate this lens degrees as well, but mostly arthroscopes are available of 30 degree and 70 degree, but sometimes the 90 degree portals are also available. So if you see this over here, there you already put in the primary viewing portal and using the anterior medial portal actually for a shaver, and means inserted through this. If you see it over here, the this is called as triangulation technique, because the person has to understand that if this is at this degree, it should be at a degree where it starts to hit equally. So this triangulation technique can be done. Now actually shaver has been used to actually shave off the rough cartilage so that the debridement can be performed, and is actually continuing with the performance of the shaver, and probably at this stage is actually doing it in the tibia, but again it can also bend this and do it in the femur as well, and same portal can be actually utilized. If you see it closely, you can appreciate there will be some water which will be coming out, and because though water will be sucked out, although we can do that as well, that we can make it show that the water is attached, inlet is attached over here and outlet is attached over here. So there is continuously pumping from inlet, as well as there is continuous extraction from outlet as well. Although sometimes this is primarily stopped once the visual field is actually starts to go blurred because of the low flow of the water, then this flow can be started all over again as well. And depending upon whatever the pathology is, for example, if the pathology of the meniscus, we can go for the repair and resection of the meniscus by using the same anterior medial portal, or if it's ACL, PCL, we can utilize the same anterior medial, anterior lateral portal to do the ACL, MCL, ACL and PCL repair as well.